All right, in the second part of Chapter 11, we are going to talk about electrotherapy parameters and effects, and a little bit about electrodes. So the contraindications, precautions, and adverse effects, of course, we will talk about, and the indications we will talk about in the individual application chapters. So for the learning objectives for this part, I want you to know how E-stim can generate an action potential in a nerve. I want you to know how E-stim stimulates a motor, sensory, or noxious pain nerve in terms of amplitude and duration, and how frequency influences the treatment. We're going to talk about a curve that's called the strength duration curve, and I want you to know what determines whether a sensory, motor, or noxious response is elicited with E-stim. So the sensory nerves are those A beta nerves. Motor nerves are going to a muscle. And the noxious response nerves are the A delta and the C fibers, the pain nerves. So we can adjust the parameters, the amplitude and duration, to determine which nerves we're going to target. I want you to be able to draw out and explain that strength duration curve and its application to E-stim. And in lab, we will be using electrical stim units to create our own strength duration curve. So I want you, of course, to be able to state the contraindications and precautions and why they're harmful. I want you to know why you would choose one type of electrode versus another, how the size, placement, and skin prep affect treatment, and to briefly be able to describe monopolar, bipolar, and quadrupolar electrode setups. So the parameters that we're talking about, we're still talking about the terminology that's in the glossary starting on page 234, and we're just going to go through more of that. Amplitude is the magnitude of the current flow. So it's often also called strength or intensity. So amplitude, strength, intensity, those are all synonyms. They can be used interchangeably. Amplitude is measured in amps or volts, but most often on the stim units, it's just a number range. And in the book, I think they make a good analogy to the volume on an audio device. You don't usually say, oh, could you turn the radio up to 70 decibels? You just say, turn it up. And it's the same thing with amplitude. So we have the numbers just so we can compare one treatment to another, but basically we're not adjusting the amplitude to a certain amount. We are adjusting it according to the patient's response. So it's not an absolute number. So we're doing it, if you're going for a muscle response, we're adjusting it to how the muscle responds. If we're going for a sensory response, we're going to how it feels to the patient. So amplitude, even though it's measured in milliamps, we usually just talk about it on the machines in numbers. And the rise and decay time is the time for a phase to go from 0 to peak amplitude and then back to 0. So generally, we're not measuring or documenting rise and decay time, and it's very short. Phase duration. A phase is the period when the electrical current flows in one direction. So the phase duration is how long a phase lasts, and it's usually measured in microseconds or sometimes milliseconds if it's a really long phase. So the pulse duration, the pulse is the period when the electrical current flows in any direction. So a pulse can be made up of one or more phases. So in biphasic pulsatile current, you're going to have two phases, and so all of the time for those two phases is the pulse duration. So the time between pulses is the interpulse interval. And all that is time. So when we're talking about the strength duration curve, which we will talk about soon, we're talking about amplitude, intensity, or strength versus time. And that's time that the E-stim is on, that pulse duration. So the frequency is the rate, the number of pulses per second or the number of cycles per second. It's expressed as pulses per second, or hertz, which is cycles per second. Generally speaking, the numbers of cycle per second is for alternating current, and pulses per second is for pulsatile current. But actually, the terms are used interchangeably. So whether you say pulses per second or hertz, both are accurate. So you can say both. The duty cycle, just like duty cycle with ultrasound, is the on-off time. So the amount of time the pulses are on versus the amount of time they're off. And we will use duty cycle, and we'll talk more about this in the muscle strength chapter in chapter 12, because that is the most common application for duty cycle. It's an important parameter in controlling muscle fatigue during treatment. So the ramp time is gradual change in amplitude during a series of pulses or cycles. And the reason that we want to ramp up and ramp down the intensity is because we want to minimize the uncomfortable sensation when the electrical current suddenly comes on and then when it suddenly turns off. So we gradually have it come on and gradually go off to increase the comfort for the patient. So even though there's all this technical stuff, we are basically working with human beings, and we're trying to make them better. So we want to do things to improve their comfort. So modulation is where we vary one or more of the parameters in order to prevent or postpone accommodation or adaptation. So accommodation is the process by which the nerve gradually becomes less responsive to stimulation. So usually with a stimulus, any kind of stimulus, we accommodate to it as we get used to it, basically. And so we either modulate the amplitude or the frequency to postpone that accommodation, that adaptation to the electrical stim. In direct current, the only parameters that we have, since the current is flowing equally through stimulation time, there is no pulse duration or phase duration. The only parameters are the amplitude and the total treatment time. For alternating and pulse currents, we have the pulse and phase duration and the interpulse interval, as well as amplitude, frequency, on-off time, and ramp time. So we will talk about all those parameters with the individual applications. So as far as the effects of electrical currents, most of the time with electrical currents, we are exerting our physiological effect by depolarizing nerve membranes and trying to produce an action potential. So the action potential is the basic unit of nerve conduction. So electrical currents produce clinical results because they stimulate action potentials in either sensory or motor nerves. And once that action potential is generated, it propagates down the axon. And that's what we're trying to do. We're trying to generate an action potential. So the nerve itself, the nerve membrane, has what we call the resting membrane potential. And it's maintained by an imbalance of sodium versus potassium ions between the outside and the inside of the cell. So we talked about the insulator, the cell membrane being an insulator because it's fat. It's composed of lipids. And so it keeps the ions from flowing. Once we generate an action potential, we depolarize the nerve, and it causes ion channels to open and allows charge to move. So we'll talk about the generation of an action potential in gory detail in neuro, but really what you need to know for this quarter is that electrical currents that we apply to the body stimulate that action potential and cause nerves to fire, basically. So the stimulation of action potentials in nerves, which is also known as NMES, neuromuscular electrical stim, is the strength or amplitude of the electrical current you're applying and the duration of the pulse is going to determine which type of nerve you stimulate. So sensory nerves require shorter pulses, and motor nerves require longer pulses. And then you see the pain nerves require even longer pulses. So basically, the speed by which the nerve impulse travels down depends on the amount of myelination on the nerve. So sensory nerves are the A beta sensory nerves and the motor nerves are fairly large nerves that are highly myelinated. So they have a fast propagation. A deltas, the sharp pain nerves, those are a little smaller, and they have some myelination. And then the C fibers are tiny little nerves, and they don't have a lot of myelination, so it travels more slowly. The action potential travels more slowly. So the interplay of amplitude and pulse duration is the basis of how we specify the effect of electrical stimulation. The lower current amplitudes and shorter pulse durations stimulate action potentials in sensory nerves, whereas higher amplitude and longer pulses are needed to stimulate action potentials in motor nerves. So in order to stimulate either denervated muscle or those C fibers, you really need quite long pulse durations. So when we're talking about sensory and motor nerves and the A deltas, we're in the microsecond range, so millionths of a second. When we're talking about the C fibers or the denervated muscle, we're in the thousandths of a second range, the millisecond range. So those are very long pulses. So basically, the strength duration curve allows us to quantify what settings and what parameters we're going to be using for our different applications. So when we're trying to use a sensory application, and usually we're using sensory applications for pain modulation, we are in very short pulses. When we're trying to do a motor application, we're going to use longer pulses. So in chapters 12 and 13, we're going to talk more about the specific settings for those individual applications. But what I want you to know for the strength duration curve is that basically lower amplitudes and shorter pulse durations stimulate sensory nerves, and longer pulses and higher amplitudes stimulate motor nerves. But you could see that there are settings that you could get where you could be stimulating all those things. You could be stimulating A betas, motors, and A deltas. If you're around 300 microseconds and maybe around 60 milliamps, you could be stimulating all those nerves. So there are settings where you can be stimulating motor, sensory, and pain nerves. So besides the direct effects of generating an action potential, there are also ionic effects of electrical stimulation. So most electrical currents used in the clinic have balanced biphasic waveforms that don't leave residual charge in the tissue. And really, it can be dangerous unless you're doing it on purpose and you're doing it safely. When you're using direct current, pulsed monophasic currents, and unbalanced biphasic currents, you actually do get a buildup of charge in the tissues, and that charge can have those ionic effects, where the positive electrode, or the anode, attracts negatively charged ions and repels positively charged ions. So we exploit those ionic effects therapeutically for things like iontophoresis. So direct current is used to repel ionized drug molecules and increase transdermal drug penetration. So the ionic effects of electricity are also used for treatment of inflammation and to facilitate tissue healing and to reduce the formation of edema. And we're not going to go into much of the detail that's in chapter 14, but just know that There is an application, of course, for building up of charge in tissues. But generally for sensory and motor applications, which are what we mostly do, we are doing biphasic currents which are not building up a charge. So general contraindications and precautions. For electrical currents, cardiac pacemakers, don't do it. You don't want to mess up somebody's cardiac pacing. Implanted defibrillators, another thing. Really, any implanted electrical device is a contraindication for electrical currents. So deep brain stimulators, spinal stimulators, insulin pumps. There are more and more these days implanted devices, and electrical currents should not be used for anybody that has any kind of implanted device. If someone has unstable arrhythmia, you don't want to make it worse by using electrical currents. You don't want to use it over the carotid sinus in the neck. You don't want to use it over venous or arterial thrombosis because, again, we don't want to break up clots and send them throughout the body. In pregnancy, you don't want to use them over the trunk because you don't want to have any effect on the unborn baby. Precautions, any cardiac disease is a precaution because you could potentially affect their natural electrical currents. Impaired sensation or mentation is a precaution for everything, as well you know. And with impaired sensation, they're not going to be able to give you feedback on how it feels. Malignancy, of course, is a precaution, and skin irritation or an open wound. So you could irritate the skin more. There are times with some of the applications for wound healing, so it's a precaution, it's not a contraindication, but you want to do it with caution and thought. So the potential adverse effect of electrical currents, burns. So we will talk about the current density of electrodes, and how skin irritation is a potential adverse effect. Most of the time you'll have an adverse effect or the skin application adverse effects with direct current, so with iontophoresis and some of the other ones. But it is potential for any electrical current. And pain. You could stimulate those pain nerves and cause someone pain. So of course we're working with our patient to find an application that is tolerable for them. So with electrodes, there are lots of different types of electrodes available, and the most common ones that you see in the clinic today are the disposable, flexible electrodes that have a self-adhesive gel, and the gel itself is the conduction medium. The gel decreases electrical resistance between the electrode and the skin. So most of the self-adhesive electrodes that we will use in the lab and that you'll see in the clinic are designed for multiple uses over a period of 1 month or longer. There are some electrodes that come, the little plastic bag they come in, the Ziploc bag, have check boxes that you can check for the number of times you're supposed to use the electrode, so you can know when they're getting worn out. Really, the more worn out an electrode is, the less gel there is, and the more chance that you're going to do some damage. The carbon electrodes are reusable, and they have to be used with applied gel, sort of like ultrasound gel. You will not see those as commonly used in the clinic anymore. Maybe if you work with a PT who's been around for a while and is really old school. There is one PT that works in our clinic that swears by carbon electrodes. He won't use any other kind, and I don't think he does electrical stim that much, but usually it's just a preference more than anything. And I don't know, I haven't really discussed it with him why he prefers the carbon electrodes. But there are other things that you see less commonly, like where a conductive thread is woven into another fabric, like a sock or a glove or a sleeve. And a lot of times you're using that for a specific type of wound healing application. And of course, they're expensive. Carbon fiber electrodes are more expensive, but they are reusable. The self-adhering electrodes, the thing that's nice about them is that you can give an individual patient their individual electrodes and you don't reuse them on somebody else. So this is an infection control thing. What we do at our clinic is when we open a bag of electrodes for someone, we have their patient sticker on there and we keep it with their chart. So we don't reuse electrodes in between individual people. I have worked in clinics where they reused electrodes between individual people, and I did not have a hugely positive opinion about that, but it can be done, but I suggest not doing it for infection control. So the current density is measured in milliamps per centimeter squared. So current density is the amount of current that's concentrated under an electrode. And so the large electrodes, you usually use them for large muscles, small electrodes for smaller muscles. A smaller electrode has a greater current density, so it's the same amount of current going through a smaller section. If you have the electrodes closer together, the current will go at less depth. If you have them farther apart, you will get a deeper stimulus. So the closely spaced electrodes, you don't want them touching because then you're going to short the circuit. But if you space them closely, it's a more superficial stimulus. And if you space them apart, it's a deeper stimulus. That is another thing where you want to know what tissues you're treating, what effect you're trying to have, and also what other things are in that area that you might affect. So your electrode orientation is important. If you have a worn electrode or one where the gel is starting to dry out, it should probably be thrown away because the areas where the gel is still conductive are going to have a higher current density. So a worn electrode gives you a greater chance for burns and other adverse effects, skin irritation. So you want to check your electrodes and make sure they're in good shape before you use them. Also, if you have oils on the skin, you're going to get less adherence, and so you're going to have hot spots. You're going to have spots that are touching that have a greater current density. So you want to make sure that you have nice clean skin with no oils or lotions on there, and you want to make sure that you have good adherence with the electrodes. If one electrode comes off completely, you are not going to have any current flowing because one electrode is not going to be there. So if it's partially touching, that is more dangerous than if it's off entirely. So monopolar is where there's one electrode. Bipolar is where you have two electrodes. Quadrupolar is where you have four. So generally, quadrupolar setups are used for a pain management setting. A lot of times you are surrounding the area of pain, and we'll talk about that specifically in Chapter 13. Bipolar, it can be used for pain management or for a muscle setting. You want to have it one on a motor point and one closer to the tendon of the muscle. Monopolar is often used for direct current settings.